Okay, so I'm here in our grooming room at Dogs Trust Shoreham with our vet nurse Lisa and the very handsome Dalmatian Comet. He's a 6-year-old male, and Comet is looking for a home, but he is also epileptic, and because we don't want people to feel too frightened about what taking on an epileptic dog means, the lovely Lisa is going to talk to us a little bit about it. So Lisa, could you tell us a little bit about what epilepsy is?
Yeah, epilepsy is when there's mixed messages in the brain, and that will often cause the dog to have fits or seizures.
Okay.
And this can be, they will often sort of lose consciousness, fall, maybe sort of thrash their legs a little.
Okay.
It's quite alarming to see, but obviously we want you to bear in mind that it's not as alarming as it first seems.
Okay, is there a particular time of day where fits may be more common to happen with an epileptic dog?
They'll often have them in the evenings when they're calmer and they're quieter. It's often thought that they will have them when they're out on walks and they're very excited, but actually when they're home, they're resting and they're in their home environment, that's the most common time.
Okay, and how would somebody look to manage a dog with epilepsy? What medication would they be expecting to give the dog?
It's treated with tablets most commonly. The tablets are given twice a day. They're very small, quite easy to give. A common side effect is increased hunger.
Okay.
Okay. It's not every course of treatment.
So the dogs can get quite sort of ravenous and look for food or quite frequently. Yeah. Okay, and the pills can just be put in the dog's food, so he's having a little play there. Hello. So the tablets just get placed in the dog's food and quite easy to give.
Very easy.
Okay, and is that usually a long-term thing for some dogs, or can it vary?
The majority of dogs that are diagnosed with canine epilepsy will be on some form of tablets.
Yeah.
Or treatment
For life. Okay. And can dogs with epilepsy have a normal life?
Yeah, there's nothing to stop them. As you can see, Comet looks
He's
pretty normal.
likes to play.
Enjoys his toys and his games. Dogs with epilepsy would need regular checkups with the vet, and they do need blood tests every 3 to 6 months, depending on the vet, just to check that they've got the right amount of the medication in their blood streams.
And for dogs that would be on medication, and particularly a Dogs Trust dog, we offer something called the foster scheme. Would you like to explain a little bit about that for people?
Yeah, the foster scheme means that Comet, for example, would be put on foster for his epilepsy. So Dogs Trust for the rest of his life would cover the cost of his medication and any treatment relating to epilepsy. The owner would be required to pay first £7.50 for any veterinary visit, and then the Dogs Trust will pay the rest.
Excellent. So peace of mind there for somebody who's maybe thinking about taking an epileptic dog on from Dogs Trust, but worried about what financial implications there might be to long-term medication. They basically haven't got to worry about that condition because it's paid for by Dogs Trust. So excellent. He's liking that. He's having a fuss there. Excellent. Thank you very much, Lisa.